I want to introduce Mary Segawa, who's a visitor from Washington State, to tell us about her experience. Thank you.
Thank you very much. I really appreciate the opportunity to be here. Is this better? And hopefully some of what I have to share can be valuable to you as we both in our states move through this grand project that we're working on. So I'm with the Washington State Liquor Control Board, and I've been with the board for about 4 years. My position there is really focused on, when I came there, was focused on prevention of underage use primarily, and then looking at policy issues and working with other state agencies on how we prevent underage use of alcohol. And obviously, my job has now expanded to include marijuana. Our mission at the Liquor Control Board is one of public health and safety, so the regulations that we do, we really focus on the public safety issues. Get the right thing here. So the initiative that was passed the same time that yours was, your amendment was passed, designated the Liquor Control Board as the agency to regulate marijuana and to put together this whole system. Because we had done alcohol with a 3-tier system of producer, processor, and retailer, the feeling was that we would be the logical choice to implement the marijuana initiative. So some of the key elements, just quickly, I want to give you a little bit of a background. Our initiative was actually 65 pages long, including the cover page. It passed by 56% of the vote, and then our agency was designated to write the rules, which we have done, and right now those stand at 43 pages. So you can tell there's a lot of regulation that's going into this. When the initiative was developed, some of the selling points for it, as I'm sure, again, you're familiar with, was we've tried prohibition, it's not working, the war on drugs doesn't work. We need to look at treating marijuana like alcohol. It's less dangerous than alcohol. We need to take money away from the criminals who are selling marijuana and bring in some state revenue. There was also a focus on addressing the disproportionality in our prisons, and that by decriminalizing marijuana and taking it the further step of legalization, that we would address that disproportionality. One of the other things that the initiative did in its 65 pages was to add on what would happen with revenues. There were some people in our public health arena that were consulted on this, and they were asked, what do we need to do to really keep this out of the hands of kids and make this a safe endeavor? And so there was money that was designated for prevention, education, treatment, and dropout prevention. And I'll talk a little bit more about that in a few minutes. So some of the issues, as I went through and kind of thought about what to present here, and thinking about what some of the key public health issues were, these were the things that really bubbled to the surface for me. So these are the ones that I want to focus on. And again, a lot of my work has been targeted at youth, and so you'll see that interwoven throughout. In terms of access and availability, we know from our federal government one of their major concerns was that we don't want marijuana in the hands of kids and we don't want the diversion to other states. So as rules were developed, we really looked at how we could limit that availability. So from the beginning, we had some consultants who estimated what they thought the usage would be and what would be a good place for us to start. And I want to underline this as a starting point. So we limited the production to 2 million square feet and the number of licensees to 334 statewide for retail. We didn't limit producer and processors in numbers, but in production. We thought these were pretty good numbers to start, and we were expecting about 2,000 applications for licenses across the board, and we received over 7,000 applications for licenses. So our staff has gone a little crazy. trying to get all these processed, and we finally, this week, issued our first producer processor license, and more will be coming. Kind of amazingly, his name is Sean Green. We didn't plan it that way. So some of the other things that were in the initiative was that no licensed entity could be within 1,000 feet of areas where kids were known to congregate, so to speak. And so that included schools, libraries, parks, playgrounds, daycares, those kinds of things. We also have put in a real strong traceability system so that product can be traced from the time that plants are 8 inches tall, at which time THC becomes active, to until the product goes out the retail door. So really trying to keep track of that product so it's not diverted. We also have real strict, we talked earlier about the packaging. We put real specific information in there about the child-resistant packaging and the labeling that is in there, very specific warning labels. Have the same ones that you see here with keep out of the hands of reach of keep away from children, and also we put the warning labels for pregnant and breastfeeding women. We have those on the labels, and we also have it regulations in advertising. So advertising, again, was restricted within 1,000 feet. This is one of the more difficult parts, is the advertising because of First Amendment. So trying to balance the rights for people to advertise with First Amendment rights. We have very similar restrictions for alcohol, so they cannot use things that are false or misleading, promote overconsumption, and then again the 2 statements about this product has intoxicating effects and may be habit forming, and that it can impair concentration, coordination, and judgment, and not to operate a motor vehicle or machinery. To give you an idea of the challenges of advertising, our medical marijuana system right now is pretty much unregulated. We keep referring to it as the Wild West right now. And 3 of these items that you see here are ads that were in a magazine called Culture that my neighbor gave to me that she picked up at a local restaurant, and it's a medical marijuana magazine that's full of ads. And as you look at that, you can see some of the problems with appealing to kids, the cupcakes, the looking like candy, the use of Girl Scout cookie as one of the strains of marijuana. So we've got a challenge already with medical marijuana in the advertising. And then you may have seen, leading up to the Super Bowl, there were a number of ads about marijuana, billboards saying marijuana is safer than alcohol and football, referring to the whole issue of concussions with football. So when you look at this, I look at these from the lens of what does this tell our kids? What are we saying to our youth? And what do we need to do about that? Just to give you an idea of where we are in Washington State, we do a survey every 2 years for 6th, 8th, 10th, and 12th graders. Our last survey was in 2012. And we asked them, we've been asking them about, have you smoked marijuana or hashish during the past 30 days? Unfortunately, we didn't just say, have you used marijuana? We have you smoked? So, but you can see those numbers. I mean, the graph is staying fairly level for the past few years. However, one of our big concerns is the risk of harm. And their perception of risk of harm is definitely decreasing. And we know from alcohol and other substances that when risk of harm goes down, there's about a year lag and use tends to go up. So we're going to be watching this real carefully because of this concern. And also thinking from a public health standpoint, what do we need to be doing to change this perception of harm for youth use? Our marijuana use frequency right now is, you're seeing that although the numbers are staying pretty stable on number of youth using, the amount that some of those youth are using is really high, with 33% using on 10 or more days in the past month. Here are a couple of things, a couple of news stories that came out right after our initiative passed and the law went into effect. Interestingly enough, it went into effect on December 6th of 2012, so you could possess, but you couldn't buy it. So we just figured it was going to kind of come down like the snow, I think, but we had kids showing up at schools telling their principal, you can't do anything to me because marijuana is legal now. No, sorry, you're not 21. Okay. We also have seen an increase, our Washington State toxicologist report on DUIs, we're seeing an increase in cases testing positive for THC. So this graph shows that. So again, there's a message out there that people think that driving under the influence of marijuana is not a problem. We had our Traffic Safety Commission, they came up with this idea of Seattle has a big Hemp Fest event every year. And so in August at their Hemp Fest, our Traffic Safety Commission had a cameraman. They took a videographer and one of their staff, and they went around, and I wish I could show you part of the actual video, but there really isn't time for that. So what I did instead was I just took a transcript of some of the things that were said. They went around and asked people, are you okay with us taping you? And they got yeses, and then they asked them, do you use marijuana? How do you feel when you use it? And what do you think about driving and use? And the one I want to really point out, and again, this was talked about this morning in terms of impairment and long driving trips. There was a young woman, I'd say probably in her 20s, who next to the last statement there, yeah, I do. It doesn't affect me. I don't think it makes any difference. I even sometimes, when it's kind of a longer drive, I feel like it's easy to just zone out on the road and just not think anything about anything else. Marijuana helps me to focus in that way, in that sense. I don't know about you, but I hope I'm not on the road when she's on the road. A little bit scary, but a real sense of, there were some people, I will say, there were some people who said, I wait 2 or 3 hours, but the majority were not thinking it was an issue. This, again, ties in with this morning. This is what we've seen in our Medicaid data about increases in emergency room visits and poisonings, so we're seeing that go up. Seeing the incline starting probably more significantly as medical marijuana was legalized and then on with recreational. And then the other health concern that I know my colleagues in our Division of Social and Health Services and Department of Health are real concerned about are the edibles and the oils. And a lot of that is because of people not really understanding the potency, or they'll ingest an edible, they'll think nothing's happening, they'll take more. We heard this morning about kids accidentally getting marijuana. One of the stories I had got recently was a mother who went to the emergency room because she accidentally ate her 15-year-old's brownie. Now, I don't know if he had a medical card. I don't know the rest of the story. But this came up in a situation where one of my colleagues who works in the community was at a meeting for a fundraiser for his 2-year-old's preschool, and they were talking about an auction. And as they talked about this auction, one of the women talked about, hey, I've done my research and we're going to do this dessert dash, and I've done my research and I'm sure it would be legal for us to use marijuana brownies for the dessert dash. Preschool fundraiser, okay? And luckily he was there. Now, this is the same woman who conveyed the story about her friend who went to the emergency room after ingesting the 15-year-old's brownie. And he assured her that this would not be legal. And he said, in addition to that, you're serving alcohol at this auction, and alcohol plus marijuana is even a greater concern. So we have obviously a lot of education to do. The other concern is with hash oils, and I know that colleagues in the prevention community are especially concerned about youth who are using hash oil because of its potency, going to the vaporizers, that paraphernalia. It's not illegal for them to have vaporizer pens, and so you don't really know what they're using in the vaporizer pens, so there's concern about the potency, where they're using it. And then we have also had a number of apartment explosions where people are trying to make their own hash oil, and they don't understand that it's that using butane can cause explosions. And so we've had that issue arise. Enforcement, one of the things that the initiative did not do, unfortunately, was have put in some money for additional enforcement. In fact, the feeling was that we would need less enforcement because now that it's legal. However, it's still illegal for underage use, which also is a major concern for our minority populations and disadvantaged populations because they're afraid that their kids are going to continue to be targeted. It's also illegal to use in public. It's illegal to have home grows, but the enforcement capacity really is unchanged, and we have local law enforcement. There's a real divergence in how much local law enforcement is willing to enforce. So there's a lot of inconsistency there. Some of our communities have decided to do moratoria, and they're waiting to kind of see what happens. Others have placed bans on having any kind of operation in their communities, and then some have done zoning. So these are ways that they are hoping to protect their communities. Our concern is, though, if you totally ban those operations, do you just leave the door open for continued illegal operations? So just a question that comes out of that. So in terms of that, the revenue, the dedicated revenue, I've listed here a few things. Our Division of Behavioral Health and Recovery is being given money to continue those surveys so that we can continue to track what's happening with youth, and are we being effective in preventing youth use or not? What do we need to do more of? They also have been given a contract, or been designated to contract with our Washington Institute for Public Policy to do a benefit cost evaluation that will be very extensive and actually extends into the year 2030. Department of Health has been given money for media-based education campaigns, local grants to communities, and a public health hotline. We also have a website, learnaboutmarijuanawa.org, that we are using as our main repository for educational information. Our universities have been designated for research monies, although the question arises, because it's illegal federally, will they take the money? I don't know yet. Healthcare Authority for community health centers, and then, as I said earlier, dropout prevention. So part of the problem, though, with all that education revenue is that we don't get it till the stores open and all that money starts coming in, and we need to do education now. So we're really scrambling with what we can do effectively and inexpensively as we await additional revenue. So again, will it be sufficient? Some of the things we have to fight is it's a plant, not a drug. Well, it's kind of both. It's a plant and it's a drug. We just had a 16-year-old at a forum say, well, is this because alcohol is addictive and marijuana is not? And no, marijuana is addictive. Again, even parents don't realize 21 is the age. We get answers 18 to 25 for the legal age when parents have been surveyed. And helping people to understand this is a different drug, this is a different plant, has different properties than it did in 1960, 1970. So the key talking points, again, are it is addictive. We want you to be successful in school. Any kind of smoking is not healthy for you. And again, the do not use if pregnant or breastfeeding. Another concern is that we're being real specific that the information that we use is research-based. We don't want people coming back to us and saying, hey, you said this, and that's not what we're seeing in the research. But as you heard this morning, that research information is very limited. So this will be ever evolving as we go. As I said, our medical marijuana system has been kind of the Wild West. These are some of the differences right now. There is not a lot of regulation or oversight, both in the product itself or who can have it. So we're also kind of fighting that whole system to try to bring these two into alignment. And our legislature is currently working on that and is expected to pass a bill in the next week or so to regulate our medical marijuana systems so that these, our recreational and medical systems, can be in alignment and not working against each other. So just a few resources that I have there and some acknowledgments that I wanted to give to some people who helped with this information and who've been very active in our state working on this. So thank you.
Thank you, Mary. And we appreciate you coming all the way from Washington State to share this information with us.
You're very welcome.
So do we have any questions from Dr. Wolk or Summer?
I have a question, and I'm mindful that I'm the next speaker, so I don't want to ask you a hard question because I don't want you to ask me a hard question. But are there legal amounts in both recreational and medical? And if so, what are those amounts and how were they derived?
The legal amounts on recreational are 1 ounce of usable, 16 ounces in solid form, and 72 ounces in liquid form. And, you know, I wasn't part of the privy to kind of how they came up with that, but I think there was a lot of research done in just, you know, what would make sense, what would allow people enough for their own personal use without having them turn around and be selling it to others. Medical, I believe right now is 24 ounces, but that will drop with the bills that are in the legislature right now have it down to, I believe, I'm thinking 2 ounces and allowing some home grows, but it's still up in the air.
Summer, do you have any questions?
You kind of answered it, but was that question around the home grows, that it's not allowed in the retail market, is that right? But it is in the medicinal?
Yes, right now it's allowed in the medicinal market, but no home grows. You can only get marijuana through a state licensed recreational retailer, is the way the initiative is written. And with the medical, more than likely the bill that comes through the legislature, right now it does allow for limited home grows.
Okay.
Mary, this session is about the role of local public health and state public health in prevention. How well do you play in the same sandbox with those folks?
We have great collaboration in terms of, we've had for a number of years a coalition to reduce underage drinking that involves a number of state agencies and state organizations, from public health to our Attorney General's office, our Lieutenant Governor, our Division of Behavioral Health and Recovery, our state PTA, and so we've been focusing on it there. We now have expanded that to include underage use of marijuana. We also have a group, the people who are being funded, we are also meeting on a regular basis to talk about how that funding is being used and how it's going out. I am doing a lot of answering phone calls and emails and going out and speaking to local coalitions and local public health units. We're really making ourselves very available to be out there. We're trying to make sure the materials that we develop are all made available to public health and to all our coalitions. We have a really strong coalition network throughout the state of Washington that local communities work very closely with their colleagues in health, in schools, in law enforcement, and bring all those people together. And so we work very hard to keep that communication, provide them with whatever resources we can, and then we use some of their resources and make them statewide.
So it sounds like you're trying to give one message out there to the public.
Yes.
Great.
Yes.
Thank you very much.
You're welcome. Thank you.